Well, welcome back to the Depths of Healthcare. I'm your host, Ben Imes. We're here for another exciting episode. We're joined by Melissa Dyer. Melissa owns her own clinic. Why don't you say hi to everybody and tell us a little bit about yourself?
Hello, I'm Melissa Dyer. And like you said, I am a registered nurse in Kentucky, Northern Kentucky, right outside of Cincinnati, Ohio. And we are really excited with everything that we're doing here. But my business is Covenant Natural Healthcare. And yeah, I started out as a nurse. Like I said, I was working on a med surg unit for a couple of
Hmm.
years. And then I switched over to pediatrics at Cincinnati Children's.
Cool.
There is where I worked with basically what we call dual diagnosed patients. So they were autistic with another diagnosis of bipolar or schizophrenia. So that's where I started my journey of looking into alternative healthcare because I felt that giving medication after medication just to mask the symptom of what was going on was something that was just really churning in my heart of this isn't going the way I thought it was going to go, as helping as a nurse. So, yeah, so here I am with Covenant Natural Healthcare. We just celebrated 15 years.
15 years. It's
15
still
years.
working.
Yes, I know. It's good. All the ups and the downs and more ups than downs, but yes, so we're definitely very passionate about helping people on a what we call foundation healthcare. So we're trying to get to the
Totally.
foundation. Yeah.
Gotcha. And so it's all about classification, right? Functional medicine, direct primary care, precision medicine. There's all these different terms out there. How would you say Covenant fits into that whole methodology?
Yeah, that's a great question. So there are so many of those buzzwords, holistic healthcare, functional, all the traditional. We're trying to bridge the gap between all of those things. So like I said, I want to go from the foundation of people's healthcare, like what is the I look at it as if you were digging foundation to a home
Hmm.
and you're digging to pour that concrete, that it's like what is at the very base of that, what is the very, very base? All the way into the traditional medical model. I'm trying to bridge that gap because there is a need for all of it, I feel.
Hmm.
So, yeah, I feel like everything is we have to focus. You hear the whole mind, body, spirit, all the things,
Hmm.
and that's true. So, I'm very passionate about the spiritual health. I'm passionate about the way that we think, our thoughts and words being frequencies that we put out there that can affect our actual health. So, if we focus on those things and getting those things healthy, if you will, then I think that also
Yeah.
manifests into the physical.
Totally.
Yeah.
Totally. Really, really cool how you incorporate all that. Now give our listeners like a good sense of so coming to your clinic for the first time, starting from scratch. Have a lot of kind of different comorbidities, but just really curious about what your clinic's doing. What kind of process are we going to go through? Who am I going to see? Am I going to see mental health specialists, dietitians, nurse practitioner? Who am I seeing?
Yeah, yeah, we've got a lot going on. So, but first, when somebody makes a phone call, I tell people we see anything from cancer to constipation and anything in between.
Mhm.
Which I feel like constipation is a huge issue that then can lead to the buildup of toxins that then leads to the cancers. But so people call and they are met with a delightful person on the other line that helps walk them through all the paperwork we make them fill out. And I
Sure.
know it's a lot, but we want people to really have an opportunity to put everything down that they are experiencing, they have experienced. We look through family history, their personal history. We want a lot of details so that we can then make sure that when they are in the office that they are heard and that they feel that we have done our due diligence to look through everything with a fine tooth comb. So their first visit, they come in, it is approximately an hour where we have them fill out what we call a system survey. And that is just a test that we have them circled if it's a rare occurrence of a symptom all the way up to a chronic, or I'm sorry, like a constant symptom that they're having. We then add this score up so that we can see what systems in the body are showing us as the practitioner that there is some malfunctioning going on. So is it the endocrine system? Is it, the digestive system? So we look at all of that. And then we have our practitioners. Most of them are nurse practitioners, nurse registered nurses. I have a speech pathologist on the staff. We have health coaches. We have a wide variety of different skill sets here, but they're all skilled in what we do here, which is called muscle response testing. So we are doing a form of kinesiology to do the basically what I call the body's innate ability to tell us what's going on in the cells.
Mhm.
So the person then is laid down on a massage table, basically, and we use the deltoid muscle to see the strength of the muscle when we push on the muscle. So we're basically trying to stress out that particular muscle and that tissue so that then when we apply ischemic pressure to the different organs, tissues, glands,
Hmm.
it's basically like hypothermia. So if the blood is pulling to the more vital organs to save the person, body can live without the fingers and the
Hmm.
toes. So
Hmm.
same thing. So if we're pushing on this arm and causing stress on the deltoid muscle, and then I go to, let's say, the heart or the thyroid, and I'm causing pressure there, if it's already stressed out, then the arm will automatically go a little weak, and we can feel that weakness happen. So then that indicates to the practitioner something's going on with this thyroid. So from
Hmm.
there, we apply the resonance of particular toxins in our environment, whether it be parasites, food sensitivities,
Hmm.
so different types of grains or milk, cheese, all these different foods, bacterias, fungus. We do all kinds of different things, chemicals, heavy metals. So
Yep.
we're looking to see then what is stressing out that particular gland, organ, whatever it is.
Sure.
Once we get that response, then we know the supplements or the herbs, the homeopathics that will then help to detox and rebuild that tissue.
Gotcha.
So yeah,
Okay.
so we do it in a way that the body is giving us the priority. So if somebody comes in and they are just a hot mess and their thyroid and their heart and their liver and their kidneys and adrenals all need help, through our testing, we figure out which one is the most important. Where do we
Hmm.
start so that the
Hmm.
body's not overwhelmed and on this massive amount of supplements,
Right. Right.
which compliance then goes down the tubes. And,
Yep.
we don't want it to be expensive for people. So we try to keep it to where we start them on a gentle detox and just a supportive supplement for that organ we're working on. And then 9 times out of 10, everything else starts to improve on its own because
Hmm.
we're doing the detox. And then we help people with changing their nutrition based on their individual needs. So
Okay.
not in my opinion, not everyone needs to be gluten-free or dairy-free or keto
Sure.
or carnivore. It really is dependent on what they have going on
Yeah.
and what
Yeah.
their goals are.
Objective.
Absolutely. So then we just help people visit by visit so it's not overwhelming. So I don't
Right.
like people to feel like come home and do a pantry purge and it's like I've wasted all
Right.
this food or my family's so upset that we went from Kraft macaroni and cheese to gluten-free macaroni and cheese. So we try to do it in steps and phases that's doable for the patient.
Yeah, yeah, because if you did all this testing day 1 or visit 1 after they've already, gone through the whole questionnaire in a sense, and then you say, "Okay, we need to do all these changes. If you don't do these changes, we're not gonna work with you. It's not gonna work." I mean, I would be overwhelmed, and I'm a rule follower.
Yeah. Yes, it can be very overwhelming. So, and that's what we've learned. We want to take people on a gradual scale to better. So, we're not looking for perfection. We're just looking for what are the controllables that you can make changes with to improve your health. And people get really great results with doing minimal things, which then I feel helps spur them on to do even more.
And it probably, I mean, from what I'm hearing from you, and you can correct me if I'm wrong, but you're not trying to just act as a primary care physician in a sense of just saying, "Here, you're gonna need your hypertension, your diabetic meds, here's your statins." You're not trying to throw meds at them. You're trying to get to the root of whatever their issues are
Yes,
and solving that before we have to even consider that discussion.
absolutely. Yes.
Yeah.
That's
Yeah.
my
So it's
goal. I mean, I'm very passionate about longevity and having the best quality of life for as long as possible. So my thing is prevention. How can we keep you off the statins? How can we keep you off the blood pressure medication? And we of course work with people that are already on those things, but the goal ultimately, if it's the patient's goal, is to help them regulate that blood pressure by changing the inflammatory foods that they're putting in or the chemicals that are
mhm,
what's actually clogging the arteries and seeing where those levels go. And we do work with people on their blood work. That's something new that we're offering now is looking through their traditional conventional blood work through a functional lens and seeing if it's because I mean not everybody I feel is going to fall in that perfect cholesterol number. Like somebody's number might be 200 and that might be okay for them based on their lifestyle and what other things they're doing. Are they detoxing? Do they take minerals? Things like
right.
that. So
Are you guys doing, like, anything with lipids or lipid profiles or apoproteins and that kinda stuff?
Yeah, when we do our blood work, so we're trying to see a lot more than what we're looking for more than just the CBC or just the basic panels that they run. We wanna see a lot of things. So I wanna know, like, the size of the molecule of the cholesterol.
Mhm.
But then when we look at thyroid, I wanna see more than just TSH and T4. I wanna
Right.
see antibodies. I wanna see all the things.
Yeah.
So, yeah, we're looking at a lot and just going into all that, I'm thinking about iron. I wanna see the ferritin level. I wanna see a lot more than just what's the base, because a lot of times what we see, and I don't take offense to this, but a lot of people were in my office and they're saying, "You're my last ditch effort." And I'm like, "No
Mm,
offense taken," because I realize that you have gone to every person that you can think of, and they're all saying, "Well, all your blood work looks normal. Your EKG looks normal. I don't know why you're having these issues.
right.
Your hormone labs are coming back normal, and they're a
Mhm.
hormonal mess." And it's like, well, is their liver congested? I mean, that's an important role with
Right.
hormones, and that's kind of a neglected thing. So, yeah,
Right. I love that. I love that you're trying to spread the net wider because, rather than just focusing in on one little subset or category, the wider you spread the net, I mean, you could get more back. And that, from my standpoint as an emergency provider, is not good. We don't like that.
yeah,
But from holistic care, it's great because like if you were if I was coming to you as a patient, I would say, hey, do as much as possible so we can figure out where to track.
yeah. And you're the type of physician's assistant that we love to work with, because you are saying, yes, cast that net wider so that we can help you on this end, because we do feel, I mean, I'm definitely not someone that says there's not a need for the medical emergency rooms, because I joke and I tell people, I'm like, if you sever a limb, you do not want me stitching you up. If you're in a car accident, do not come here to go to the emergency room. So,
Well, that's and what I feel like your need or what Covenant is kind of supplying or trying to fill in this gap is in the US, what I've found is that we are excellent at acuity, like high acuity care, emergency care. We are probably the best in the world at stabilizing life threatening emergencies. But
absolutely.
then I think we are severely lagging behind in chronic care or even just preventative care overall. And so it feels like you're trying to fill that gap in
Yes.
between.
Yes. Yeah, that's exactly right.
And how's it been? I mean, what, we're in 2025. So 2010 kicking things off. I mean, how did you even start or initiate, like, looking for providers or talking to, I mean, did you just say, okay, I've got, a couple $1 million cash saved up. Here we go. I'll buy a building and go in.
No, yeah, I love the story. So, as I was saying, I was a nurse at Children's Hospital, and I love the idea of being with the kids and helping to improve their quality of life, but I felt like
Yeah.
my hands were tied.
Yeah.
It was these kids with autism, and a lot of them were in foster care, or they were in a very, very horrible home life situation. And so they're in the hospital so that they can be rehabilitated to go back home safely for themselves and their families. They have no structure. They have horrible diets, and the medications that they were on a lot of times were increasing their appetite. But then we had strict control over, nope, it's kitchen's closed. You're not allowed. Well, these kids would get so aggressive if we wouldn't let them have their red
Yep.
dye fruit roll up. And
Yep.
so I'm just like, so then as the charge nurse, you would go into rounds and you'd have to report on whether this one slept well, were they aggressive? And it was just like, okay, let me hear that as the psychologist or the doctor on call that day. And it's like, well, let's add another medication to then calm them down even more.
Sure.
And it was a kid that I had very regularly. He was in and out of the hospital a lot, and I remember him looking in his cup one day when I gave him his medications, and he looked up at me, and he was probably 6, and he said, "Why do I have more meds today than I did yesterday?" And I was just like, "I can't, ethically, I'm like, I cannot do this anymore." So, a woman of faith, I just really prayed into what is a different path I can take with still wanting to help people. So I
Right.
was thinking through, what am I passionate about? Like, what do I want to do?
Mm,
I love cars, even though I know nothing about them, but I was like, I don't want to be a car salesman. I don't want to do. I love nutrition, but I wasn't really sure what does all that look like. I love physical training, but I didn't wanna be a personal trainer. And one day I found Covenant Natural Healthcare as I was scrolling through what are some I was looking for an acupuncturist or a reflexologist or
Mhm.
what's something I can do that's more in this natural realm. And so I called and there was a naturopathic doctor who started Covenant in 2005 and his wife answered the phone and she said, "The doctor is too busy to talk to you right now, but can you come in tomorrow for an interview?" And I was like, "What am I interviewing for?" So I was like, "Sure," because I'm miserable enough to say yes to this. So I came in the next day, and when I walked in, the 3 of us, the doctor and his wife and myself, we still laugh today and say, "We knew that as soon as the door opened, like, this is it."
Mm.
So they were actually looking for a receptionist, but when I said I was a nurse and I was just not pleased with what I was doing, they just took a leap of faith and said, "Do you think this could be our next practitioner?" So, I shadowed him, and when I'm watching this muscle testing going on, I am like,
Mm.
"This is weird. I don't know about this. Like, this seems like some kinda snake charming stuff. I'm not in anything, like, this is crazy." But as I was watching patient after patient leave and talking about I was gonna have to have my gallbladder removed, and after seeing the doctor, I haven't had to have that. I've been symptom free for 3 years now, and I was watching people walk out with smiles on their face and hope, and I'm like, "This is what I've been looking for as a
Yeah.
nurse." So I just to make a long story short, I took a leap. He sent me to school to be trained at schools in Florida, and so I went to Florida, got trained. I've been through the program twice because it's so much to learn.
Mm.
And it's so different, I think that when you're used to sick care, what I consider
Yeah.
sick care, and which
True.
is a need, but when you're used to just hearing a symptom and knowing what medication goes to it, I had to wrap my mind around a whole new world. And
Yeah.
so outside of learning the homeopathics and what they do and the herbs and the different vitamins and minerals, it was like there's a reason why there's this symptom, but let's not just chase because I could do the same thing with supplements. I could chase symptoms
Mhm.
all day long with
Yep.
herbs and homeopathics, and they work very well. But then as soon as you take that person off of those things, the symptoms come right back, and that's not my goal. So anyway, I took over Covenant in 2010, and at the time we were seeing about 30 patients a week, and now we're averaging about 350 to 400 patients a week. And
What?
when I first started, it was actually just me and one other staff member, and it was every 2 weeks, my goal was to make sure that I could pay her paycheck, and so I didn't pay
Yeah.
myself for a really long time, and,
Wow.
it's just been a very blossoming, flourishing, wonderful blessing, and so everybody that's come on my staff has started as patients, and
Wow. Isn't that cool?
it's policy that you have to be a patient to work here because what we do is so different, uh, and I want people to have that as part of their testimony when they are patient facing to say, "I'm on the same journey that I've been on the same journey, I'm continuing the same journey that you're getting ready to embark upon."
Right.
So it's been
That's
well.
so special.
Yeah.
Wow. I mean, and also what a journey. I mean, to just, go from traditionally trained RN, hospital-based medicine, and then just a hard pivot just by taking a chance.
Hard pivot is a great way of saying it.
Yeah.
That's
Yeah. Because
yeah.
you're still helping people. I mean, that's what I think. I remember even just talking. I mean, everybody has their own sense of their why, and that's across all my listeners know everybody has a different why. And, some surgeons think that, yeah, I see them when they're broken and I heal them and then they're better. And I love that. And that's what is my why. Other
Right.
people are like, I like joining people on their journey as they heal. I mean, you're very similar to a couple other interviews we've had about like lifestyle medicine. It's not this, quick change. Here's your GLP-1 and then boom, everything's cured. It's not this magic pill, but it's a journey. It's a journey. It's you have to I and you probably tell that to your patients, I'm assuming when they show up. It's like this isn't just like, show up every year and check in. It's like this is a pretty intensive like we're going to be getting really close to each other.
Yes, yeah. We definitely tell people first of all, it's a program. So again, so that we can walk people through step by step and not having it be overwhelming. But then we often tell people, this is a marathon, not a sprint. And it's very possible that you'll feel worse before you feel better. But my own personal journey, I mean, I grew up on your typical standard American diet. And from the age of 7, I was covered in psoriasis. I mean, the only place I was spared, thank God, was my face. But from the neck down and then in my
Yeah.
scalp, I mean, it was horrible.
Wow.
Just refused to take medications for it just because of the side effects, and, I knew in my heart that I can keep putting these creams on, I can keep going to the tanning bed, I can keep doing all these things, but once I stop, it comes right back. It might be gone for a month, but it's gonna come back, and I'm like, "What
Right.
is the root?" I mean, it was just taking a journey on changing my diet, taking good supplements. It took 5 years, but it went away and it's never come back, so
Wow.
that's
Wow.
it's a huge testimony that I do get to share with patients, but it's the example of what you just said, and that is that it is a journey and you have to be really patient, and sometimes you wanna give up. I mean, there are times where I'm like, "I'm just gonna take this injection so I can get rid of this stuff."
Yeah,
So I
sure.
understand people that are looking for more of those quick fixes, and sometimes I feel like it's necessary, just for the mental capacity of it. Not everyone is like, I mean, I wasn't married at the time and I didn't date, so I was like, "I can cover it up, I don't care." Other people may not be in that boat where they're like, "No, I'm dating and I wanna wear skirts," and so, yeah,
Yep, and it's all very subjective at that point.
absolutely.
What now tell us about the journey of, I mean, so from in 2010 when you take over and you're like, it's your child now, right? I mean, what are the bumps and bruises that you gained along the way? What are the big lessons that you had to?
Well, it's interesting that you say, "What lessons did I have to learn?" Because one of my staff made me a T-shirt that says "Lessons learned" because I felt like it's all I say. I'm like, "Well, lesson learned, lesson
Yep.
learned." I think one of the biggest challenges that I've had, and it's been such a mission of mine to grow this baby, and I do
Mhm.
feel that that's exactly
Yeah.
what it is.
It's
It's
your
like
child for
a child,
sure.
yes. And I'm so passionate about it, and I love the patients, but the internal part of it, I love pouring into my staff. I love encouraging them. I love doing continuing education and being in the
Mm,
trenches with them. But
mhm.
I think that that has been the biggest challenge is having the growth of staff because you're dealing with number 1, we don't have any men on staff yet. So we are a lot of ladies with a lot of emotions and a lot of hormones and, a lot of different phases of life. I see you have a wedding ring on, so I'm sure you have somewhat of an idea of just the journey that women go through. But it is challenging to add people to an already really tight knit group and you add someone else in. And although we are very welcoming, I never really put myself on the other person's side where it's like they don't yet feel accepted because they're the new one, and it's like, where do
Right.
they fit in, and who's their close friend within the office gonna be? So the challenges with the staff has probably been the biggest lesson learned with things that I've unfortunately, being very transparent, there have been people that I've hurt, just not knowing the right way to go about things, trying to people please a little too much for other people that it's like trying to make this one happy really hurt this one.
Right.
That's where I'm trying to grow as a leader is to
Yeah.
love them the best way that I can, but to remember as a parent basically is what rules apply to one apply to all, and I can't make everybody happy with different policies and procedures that I put in place. It's going to affect people differently. Structure's important, when you look
Yeah.
at this as a parent, it's you have
Yeah.
to have it.
Think about it. I'm thinking about it as you're maturing your business, you know, just as a child goes through maturity in different windows and gains maturity. I think you learn what's working best or what's working well. And then when you get an idea of how to do this better, there's going to be pushback. There's going to be friction, you know, but you have to be the one to kind of lead in that way and say, guys, trust me, get on board with me. Like it's going to be rough in this little period, but it'll be better on the back end, whatever it may be.
Right, right.
Yeah.
They've all been so wonderful. So I have right now 17 staff and they've all been growing with me. So it's still a growing process and I'm not finished. I still see so much in store and it's awesome. But I have to remind them that we have been on a rocket ship of growth and they've been along with me the whole time. And there have been so many lessons learned. but thankfully they've been gracious and given me grace along the way. I'm very, very open to owning where I've made mistakes, so I think
Sure.
they can appreciate that. I hope so.
Well, yeah, I mean, it draws people in. I mean, that you have 15 more employees than than you started with is
Right,
testament to that, because humility draws people in. It
right.
doesn't push
Yeah,
people away. That's very admirable, and I think it exemplifies your leadership in that way.
thank you.
Yeah, and I think so. Where do you see this going? I mean, so the kid is maturing,
Yeah,
right? He's in his 15th year. He's in his teenage years, and
right.
where are your visions or your dreams of where this progresses to, and how you can kind of, obviously you've seen incredible growth. You're not. I don't see you as as a leader and a business owner to just say, okay, we're good. We're going to stay right here.
Right. Correct. Yeah, thank you. Yeah, and that's such a great question. Right now, I've had it on my heart over the last year. So I want to find a space where it's laid out a little bit more effectively than what we have right now so that we can work more efficiently together. But we have what we have and it's great. And I'm going to be patient and wait on that. There's a point that I bring that up. When we were looking for space last year, I found a space and I was like, this is it. It ended up not working out, which I'm grateful for because it was a massive building and I don't know how I would have been able to maintain it. But the point is I was able to get a vision of what I wanted, and what that led me to see was more of a spa side and the clinical side. Within that spa side, I saw this one of the rooms, I just saw this one needs to be a couple of chairs, a table, and I just saw a box of tissues. And I'm like, "Okay." So, recently, I've been feeling like something's missing, and I just keep asking, like, "What is it?" And I feel like I need to offer something for free. And so I'm like, I'm gonna start offering prayer. If people wanna come in and they just wanna get prayer and it be a way for them to almost have a listening ear and have somebody just talk to them through some of their things. I'm not trained as a counselor, but I've had life experience and a lot of the things that the people come in, I've experienced that myself. So I'm like, we're gonna open this up. We're gonna see where this goes. So that's the next thing that we're hoping to open up as of January, and from there, I feel like that's gonna be a very large open door for whatever is
Hmm.
next, 'cause I feel like just being obedient and offering something to someone for free, and I know it's not all about money, but I feel like everything's been so expensive, and you can't really go anywhere and get anything free,
Right.
but I feel like I have 15 years of people's trust. And so I mean, my office manager, she's like, "You are not gonna have enough time in the day."
And you're going to do this yourself.
I am gonna start doing it myself, yeah.
Boy,
And I'm praying into having a team eventually of people that can then join me so that it's not all on me.
sure.
But yeah, I feel like right now I'm the one that is open to it and willing to do it, and I recently just stepped away from seeing my own patients. So, as of the end of December, I am officially finished with seeing my own patients. So that's been a huge shift in my identity because
Totally.
this has been my identity and they become my family and
Right.
it's been very hard to tell them, like, "I'm gonna pass you on to somebody else. They've all been trained by me, and they're great." But yeah, so that's part of the new journey. So right now what I'm doing is a lot of these things, like just getting the word out about what we do, community outreach, speaking to as many people as possible about the health of the overall spiritual mind, body, all the things.
Yeah, you're stepping into more of the, now the true CEO marketing director role.
Yes, which is
Yeah.
new for me. So, I mean, I've had to be transparent with my staff and say, I've never had to do any marketing ever. It's all been
Yeah.
word of mouth and it is spread like wildfire. And so I'm like, this is the first for me, but I love it. I'm excited to do it.
Yeah, it's
So
very
as far
exciting.
Yeah. So as far as beyond the prayer offering, I would love to have more services available, such as counseling. I would love to have a chiropractor and a massage therapist and an acupuncturist. So I would love to offer all these things for people to pick what they wanna do within Covenant.
Really, really cool. Yeah, you could then become, you know, not I don't want to say, I mean, if you say it, I'll agree with you, but kind of maybe a concierge, not truly concierge of I show up, I pay you, I want this. It's more of just saying, hey, I recommend this and I think this could benefit you from the provider side,
Yeah.
right?
Yep. No, that's
Yeah.
great. I like to call I picture like a holistic hospital is what I picture.
Yeah. Yeah. I like that. Yeah, and maybe that build that really big building or that really big, spot then becomes too small.
Right. I like that. That's a good way of putting out some positive frequencies there. Could
You
be
have to think that way, right? I think, to the different like the listeners here, like different business owners that we've talked with, or some are just very content, they've been bought by private equity and they're just doing what they've always been doing, but somebody else is running the business. And then others are like, we have so much room to grow and this could explode beyond my capability of being able to handle it. And I desire that because it helps us to grow into that. And I
absolutely.
think you're of the latter, not the former.
Yes. Yeah, no.
So that's really, I mean, that's really awesome. So where can people find you? Like where can, if they're curious about what you're doing and kind of keeping in touch and maybe, even if some of the listeners are in your area, website, LinkedIn, social media, is it any of that the best resource?
Yes, so well, of course, covenantnaturalhealthcare.com. And to that, we do have a telehealth program that we help guide people through our program. We have practitioners that see people, and I have one in Canada. I mean, not a practitioner, but a patient from
Oh
Canada.
yeah, yeah.
We have patients from North Carolina and Chicago. We have them all over the place that call in and get guided on how to detox safely and effectively and run through the program. So definitely visit our website for information. All our services are on there that explain what they are and what we do. And then, yes, we're on all the social media and
And
LinkedIn.
that's your domain now. You're the marketer.
Yes,
You're the
yes,
content creator.
yes, which I am. That is not my skill set. So I do have somebody that helps me with that. But yeah,
Good. Good.
yes.
Well, very cool. I hope people can hear the goodness coming out of you. It's emanating from you, that they're hearing the good vibes and,
Thank
that
you.
they really, I mean, even just following the journey. I mean, I'm just intrigued to follow the journey as a
Yeah.
fan. I'm a fan.
Thank
So,
you.
yeah. Yeah, but I hope that things continue to grow, things continue to progress and that your dreams that you have, I just hope that those are realized or even, you didn't dream big enough,
And I
you
always say,
know.
like, you gotta dream big,
You got to dream big because crazy stuff can happen if you do.
right? Yes.
Well, that's all we got for today. Thanks for your time.
Thank
Thanks.
you
I
so much.
really enjoyed this. How about this? We'll consider a 1 year check-in or a
Absolutely.
6 month check-in and we'll see how things are going at that
I
point,
love it.
rehash it.
I love it. Thank you
Cool.
so much for having me on.
Thanks, Melissa. Have a good one.
You too. Thank you.